Hello there everyone and welcome to another episode with Feel Good with M.E. And today I have the pleasure to have Dr. Philip Blair. He is a medical doctor. He worked in the army for many years as a doctor there, and he can tell us more about it in a minute. And he specializes in CBD, in cannabinoids, and he's going to tell us how CBD and related cannabinoids and terpenes may be useful in autoimmune condition and post-viral infections. So it's just going to be very interesting. So Dr. Philip Blair, if you can introduce yourself to us and then tell us a little bit about what actually CBD is and how it may interact in the body and how it may be beneficial to us.
Well, yes, Eden, I'm really glad to be here with you and talk about my favorite subject, which are cannabinoids and their impact on the body. I was a physician in the Army. I joined in 1972 and I retired in 1997. I spent my time as a family practitioner and I was in combat in the Gulf War I. Since then, I have been working in various positions as disease management and as also for a health and wellness. Now, in 2014, I learned about CBD and I did the research, I reviewed the topics, and I was blown away by the impact that this molecule could have on the body. And so I devoted myself for the last 6 years, well, it's going on 8 years now, that I've been devoted to this molecule and what it can do for the body and the different ramifications that it has. CBD is a fabulous compound that has connections with all parts of the body, but it mainly works by restoring homeostasis. That's the balancing system within our own body. It is the master regulator of so many of our other systems, vascularly, gut-wise, inflammatory in the immune system, and neuroregulatory. So it has a huge impact on our bodies to the point where we have identified that there are endocannabinoid deficiencies in the body, and we're evolving that particular science. As a result of Dr. Ethan Russo, he pointed out that there are these deficiencies and that cannabidiol is one of the cannabinoids that can correct for that. And I think that it opens up a huge potential for all of diseases and all of health and wellness. Now, I have finished a book and it is published now. It's Medicinal Cannabis and CBD in Mental Health Care. And that's available at Amazon. And I've also done some other projects, and including a development of a new cannabinoid, well, not a new cannabinoid, but a new cannabinoid substance called liposomal BCP that is now currently available. And I'm doing testing and I'm providing that for many people who have possibly cannabinoid deficiency and that could benefit from it.
That's fantastic to hear all the work you do in the field, and congratulations on your book. I have to get it, and I will leave the link in the description below for people who would like to read it. And so the next thing I'd like to CBD seems to touch the cannabinoids, so many parts of the body. As you know, I've got ME, chronic fatigue syndrome and fibromyalgia. And one of the things that got me into it, it's when I originally tried it. It had such a strong impact on my sleep quality immediately and on pain. So with the pain that you can often get with ME and fibromyalgia, doing things like that, pushing your hand, would be very painful. And it was unbelievable that after a few days of taking CBD, I've noticed out of nowhere, maybe even after the next day it could have happened, but just I've noticed that I can push against my fingers and there's not pain like that. My mom has arthritis. where to a point where her fingers are bending, and she suffered terribly with digging pain. And when she started taking CBD, she noticed the difference, how the pain is subsiding, and she can't live without it. It just makes her living so much more comfortable. So maybe you can tell us how come it seems to be so helpful in pains of the joints, in inflammation, in sleep aid, and also, I know I'm throwing at you quite a few things all at once. Like me and my mom, we were worried at the beginning to try it. I got to try it through a very good friend of mine and an old mentor of mine, David Powell. We never really smoked cannabis or anything like that, and it was a bit daunting for us to try it. So maybe you can tell us a little bit the difference between the high which you can get from some cannabis and medical cannabis. And of course, now I know there's nothing to worry if you do it in a small dosages and in a comfortable place, then it actually has in itself the THC molecule. Maybe you can mention that, some benefits in itself as well. But yeah, maybe you can go a little bit deeper for us and teach us how to get started. Is it suitable to everyone? But anyway, I'll throw to you those questions as we go along, so we cover them.
You got quite a bit for me to cover, but I think principally you have marijuana on one hand and you've got hemp on the other hand. Marijuana contains THC, which is psychoactive and can be irritating to some people. On the other hand, hemp doesn't contain any THC, but it contains CBD. And CBD is the miracle molecule that we're talking about. Now, CBD works very specifically on a number of receptors in the body, but its main role is for enhancing the endocannabinoid system that is naturally found in our bodies. It's called the endocannabinoid system, and it orchestrates and it controls many different aspects of our body, in particular, inflammation and sleep. Now, these two areas are different. They're different mechanisms, but they're principally they're similar in the benefits that CBD provides. Now, for pain, we know that CBD signals the receptors, particularly the CB2 receptors, and to reduce inflammation and to reduce the neurotransmitters that are so highly related to inflammation and to pain. Now, with regard to sleep, CBD has the effect of improving the depth of sleep, the quality of sleep, and regulating the circadian rhythms that people go through. So you tend to sleep better, you sleep deeper, and you sleep more refreshed with CBD. Now, what else did you have for me?
So this was great, and I think you covered quite a lot of that. Maybe you can tell us a little bit about, we hear about full spectrum, different terpenes, flavonoid, dosages. Can you walk us through that, and also how to get started if we felt we're ready to get started? And is it suitable to everyone to try, or are there certain things we should be considering before?
Well, primarily the studies have been done on isolated molecules, and that's the topic of pharmaceutical industries, that they try to develop silver bullets to target individual diseases. Well, in the case of a biologic herb like CBD, then that is better orchestrated with an entourage, a number of the other substances that are contained within the hemp plant. And these all add to the benefits of the effects that CBD can bring. So I always recommend a full spectrum, including a little bit of THC, and then the fullest spectrum possible in the most benign extraction technique. It will deliver the best effects from the extract that can be accomplished. Now, the studies have been done on isolated CBD mostly, and those have been pretty good, but they don't equal the studies and the performance of a full spectrum CBD product and a full spectrum hemp product in terms of analgesia, in terms of sleep effects, and in terms of overall benefits for anti-inflammation. And it's because the Entourage contains other cannabinoid molecules like CBG, CBN, and the acid forms of CBD and THC. Now, all of these blend together to provide a complement to the actions of CBD on the body. Not only that, there are terpenes that are contained in the hemp plant that are so valuable. Now, the terpenes are the oils that have a particular odor and a strong smelling that you can sense, and a lot of the flavor that goes on with them. But these are important as individual signaling items that may have many different effects. And there are also flavonoids, and there's polyphenols that are also very valuable in terms of the signaling of the body and orchestrating good health.
Amazing. Thank you so much. I guess I would just add with terpenes, I made it a bit easier for me to understand because I don't have a medical background. It's what you're referring to, and correct me, it's basically, it's like this, in essential oils, what gives the lavender the smell, it's the terpene, and in lemon or lemonine, that's the terpene that gives the lemon. So, okay, and that I guess has antioxidant, anti-inflammatory, and all the good things. And when you say entourage effect and taking it through full spectrum, again, I would consider it, well, I had chatted with you before, so I know exactly what you mean. But it's basically, instead of just having the sugar or the flour or the water individually out of the cookie, when we have the cookie all together, that's when all the flavor and all the benefits are coming together. So maybe like that, it's easier to relate. And it would be good if you can tell us if there's any specific medication that we know it may interact with, and also dosage. Is it, as it's a full spectrum, I guess it's not, it's a bit harder maybe with the dosage, but specifically, but maybe you can cover that. So we want to know dosage, medication interaction, if we know of any side effect, and then how do you choose a good quality? Because there's from gummies that you chew to a drink, we hear water soluble, we hear all sorts of different things. So how does that work? Maybe you can take us through that.
Well, again, you've given me a lot to handle, but you asked an earlier question about who should not use CBD. Well, I don't know of anybody who should not use CBD. It has a potential of helping so many different problems, whether it's psychological or physical, and emotional for that matter. And it has a particular property towards preventing serious complications of illnesses from ischemia or a loss of blood supply, like with a stroke or myocardial infarction. So it has really valuable potential for everybody, but it doesn't work in everybody. And the dosages are quite variable for an individual, depending on what the makeup of your endocannabinoid system is. So that in choosing a dosage, you may find that it will take 1 drop or it'll take 100 drops. We don't know the science of that specifically, and we can't tell from any laboratory testing that we do. So in general, you have to do a generally recommended sampling, but that could be reduced or it could be increased depending on your specific need. Now, in terms of interactions with drugs, now classically the isolate CBD has interacted with a number of different substances when it's used at the high levels that are required for an isolate drug. But when you get into the realm of full spectrum, then the dosages are radically reduced and there is no significant interference with any therapy, any drug that you encounter, whether it's blood thinners or it's chemotherapy. you can take you can take those drugs and you should not have any particular problem with them. Now, there could be an exception, but I'm not yet aware of any complications from that. Now, some people are exquisitely sensitive to the cannabinoids. And so if you are one of those people and you have a history of being sensitive to aspirin or Tylenol or just a simple drug, then you should start very, very small dosage. But then I recommend working up quickly to find the dose that is ideal for you. Because it works immediately, and you take it under the tongue, you get an immediate effect through the transmucosal absorption or the sublingual absorption, and you can feel the effects right away with that. Well, I think I've covered most of it. What would be a right dose? I would say I have used commonly 15 milligrams. Has been a pretty standard dose and for adults. But when you get into children or into seniors over 70, then you usually want to cut that dose in half. So it would be like 7.5 milligrams. And I usually like to have it twice a day. Now, ideally, it is taken with a fatty food or a snack or a meal, and improves the absorption. And it's absorbed through the intestinal lymphatics when it's taken in with a long chain fatty acid. So that's the oils that we were talking about. And those oils help by getting it intaken into the intestinal lymphatics, and that circulates within the lymphatics, and it doesn't get processed as quickly by the liver. Now, that's important because you want to have as much of the CBD circulating as possible, and you want to have it active as much as possible. And then also the fact that CBD is working primarily on this immune system that we have, then it's going to be important then that's the ideal milieu for working on the immune system, because the lymphatics go through the lymph nodes and the spleen and our other key lymphatic organs.
That's amazing. Thank you so much for breaking it down and helping us there. It is quite it's a bit like a biological chemistry lesson with you, and I think I would like to have you back in future just to go over those systems a bit more slowly. And so, because I'm always fascinated learning and understanding things at a deeper level. But is there any known effect on viruses maybe that CBD or cannabinoid? I know you mentioned the immune system seem to benefit from the cannabinoid, so maybe you can tell us a little bit about that. And then also, I know you work on a specific terpene that targets certain receptors in the cannabinoid system, so I'd like to hear about that as well, please.
Well, I had the experience of being on the Ruby Princess in Australia when it was cruising in March of 2020, when there came upon a COVID outbreak. At that time, it was early in the course of it, of COVID, and we had over 600 or 700 people came down with COVID, and 30 people died, but my wife and I were unaffected. And I can only attribute that to the fact that we were taking cannabidiol and caryophyllum as well. But the main thing was that there was CBD. And after that, I looked into a great deal of detail about the benefits of CBD with COVID. And I have at least 21 different mechanisms in play as to why the CBD would be protective against getting the infection and then managing the illness that people acquire with it. First of all, it prevents the protein, the virus from getting into the body. It regulates the ACE2 in device and a receptor. It inhibits the pro-inflammatory cytokines that are related to the inflammation that's related to serious illnesses. And there's a host of other mechanisms that are involved. One of them, my favorite, is that it concentrates intracellular zinc. And zinc is an important factor a critical factor for preventing viral disease. And this is key and important for the process of infection. Not only that, it regulates the proteases that prevent viral translation and the proliferation within the body. So as a result of that, we have some studies that have come out that have shown definite benefits of CBD. And I think the classic was at the University of Chicago, where they sampled their patient population for several thousand people, and they found that there was a general rate of COVID of about 12% for everybody who was in their patient database. Whereas those who were taking cannabidiol had a 1%, a little bit more than 1% rate of infection. So it's terrific for preventing, but it won't prevent all cases. Hopefully it will mitigate against the inflammatory and the reactions that do occur with that. And I think there's a good potential for doing that, but it should be a full spectrum type of cannabidiol to really make those particular benefits. Now, not only is it effective for COVID, and it's also effective for the medical personnel who were treating COVID. And that's because it eliminates the exhaustion and the frustration and the sleeplessness and the sleep disorders that generally come from it. And a study down in Brazil targeted some 60 medical professionals who were engaged in it. And they had reported to a medical clinic for exhaustion type of symptoms. And the CBD was used at 300 milligrams. It was an isolate product, but it was still accomplished its mission. And as a result, none of the people had to stop working. They improved their sleep. And not only that, but although they took it only for a month, they had the symptoms, they had reduced their symptoms, and that reduction in symptoms lasted for at least a month longer than when they were taking the CBD. So you can see that it has a beneficial effect on the body, and it's sustained over a period of time.
This is amazing. It's so great to hear those things. And I know those are small scale studies we can see, but still it's very inspiring, and it shows the potential there, it's what we want to hear in your story with the boat. And that I remember it was in the news, it was really bad, and wow, it's amazing that you and your wife stayed protected. That's really good.
And not only that, we've stayed protected against the local illnesses as well. My son and his wife came down with COVID about 3 weeks ago, and we were unaffected by it. Now, we didn't have, I didn't expose myself in great way, but we had almost daily contact, at least from a distance, and with masks.
Wow. Yeah, no, it's I think there's a recent study as well, maybe it was in the UK, like less than a month ago, released by a pharmacist or a chemist, and is a PhD, I believe, in this, and he talked about the same way you talk about that. It has an ability to reduce the infection, and also it seems to break down the virus or something like that. I may include the study as well below, so people can see. It was really good news. And then is it a supplement, a substance, because it's true full spectrum and it's a plant? So I compare it sometimes to, it's like a mint tea. You can drink mint tea every day, and indeed people in Morocco and Algeria and Tunisia drink, I think, like 2 or 3 or 5 cups of mint tea every day for throughout their life. There's certain benefits to drinking it in the heat, even though it makes you sweat and the wind comes in the Sahara Desert, and apparently it cools you down. There's something like that. So is it something that we can take every day, a true full spectrum CBD, or is that something that we take for a couple of weeks, a month, stop? Any thoughts on that? Any?
Yes, I think for longevity and for health, I think it should be taken every day. I think that the overall benefits, and you can see these in your alertness and your cognitive ability as well as your physical ability. You mentioned some issues with arthritis. The other part of not only controlling the pain, it increases the range of motion of the joints. So it seems to facilitate the lubrication of the joints as well. So you have better movement, you have less pain, you have improved sleep, you have better cognitive function. And the studies are coming out that show that it enhances longevity. So it's going to reduce diseases and death of cells and encourage nerve generation in the brain and nerve connection generation in the brain. So it's got so many valuable properties that it appears to be something that could be benefit for everybody, at least in some time. Now, because it has sustained action, it doesn't have to be taken all the time. And for many of my patients, they will stop for one reason or another if they went on a trip or they did something unusual and they ran out for a period of time. And some people don't believe that it helps them. And so they'll take it for a week or two and they say, this really doesn't help me. But then when they stop it, then they find out why they were using it and why it's helped them. Because all of these subtle resolution of symptoms comes back. The brain fog, the pain, the stiffness, the cognitive dementia, all of that seems to come back. It reminds me of a story of a patient I treated in Australia with dementia, and she did beautifully. She responded wonderfully. But she, as a result of her recovery, she went to Africa on a trip, and a safari trip. But unfortunately, she didn't take her CBD with her. She was fine for the entire trip. She had no problems. But when she came back, she crashed and she became very much the resumption of the symptoms. So, and then she started back on the CBD. But my point is that you can take CBD for a while. It can upregulate the endocannabinoid system, and you can be balanced for up to a month if you have to go without CBD for a period of time, and you still have that recovery potential with it.
That's great to hear. How we helped her in that stage of her life and with the dementia, and it's also good to hear that it can stay circulated in the system for a little while, and then you just keep on topping. And I guess it's quite natural. I'm sometimes skeptical with supplement, as many people are, but I guess it's like food. We can do a water fast for a little while, but eating always give us more energy and good. And as I say, if chamomile tea helps you sleep, and mint tea helps you cool down in the sun, and CBD helps you stay sharper, more focused. With me, sometimes I feel I can see a bit better with it. I do wear glasses, but sometimes I feel my vision is a tiny bit better.
Oh, definitely. There's a very definite clarity to the vision, and that's one of the things that I point out. I frequently do supervised testing or sampling with CBD, as I do with other substances, because I want to see the reaction, and I can see a number of different positive aspects. And one of them is the vision, and I point out that the vision definition, your distant definition, the amount of light that's coming in, the amount of colors that come in, and the peripheral vision. And then there's a refinement of your vision in particular, so you can see greater detail in a distance. In addition, you have a improvement of against eye fatigue. And I really believe that there is a significant impact on retinopathies that go along with it.
Wow, it's great that you actually use it as a test. No, definitely with the vision, I feel something there is there every time I
Well, in
take it.
addition, I see vascular changes to it. When they first take it, there'll be a flushing of the skin of their face and of their chest. And so they'll feel a warmth that comes over them. Then there's a voice change that occurs with it too. They'll have a deepening of their voice. It's because of the vocal cords relaxing. And then they'll start, I notice a change in their countenance. They'll start using their face more. There'll be more expression. And there's invariably, there's laughter. They will laugh, and it's not riotous. It's not out of proportion. It's just a chuckle or a laugh or a humor that is shown with the effect. And then they're thinking cognitively. They're thinking in processing, and they're clear in their thoughts, and they're processing ideas and images and understanding very, very vividly.
Amazing too.
And I can get that out of 10 minutes of a supervised interview.
And I have to say, when I first gave to my mom, as you know, I used to have a vegan cafe, and I would sell my CBD there and see the reaction. But I remember the very first time I had it with my mom together in the cafe, we were giggling for the first hour or two of taking it. Of course, it was a bit as well psychological, because she felt very naughty for taking the cannabis. There was CBD, and but it definitely, you can feel that relaxation and it has an uplifting a bit of effect. I guess it's because it's natural anti-anxiety. But that point brings me very good to because you've written a book about it. So we spoke how it can help on a physiological level, but emotional and mental well-being. If you can talk to us a little bit about the power of CBD to the emotions and to the mental well-being, I think that has a really key element, because often people with long-term conditions, it can be very depressing, especially with ME, chronic fatigue syndrome, fibromyalgia. Often it tends to happen in between our 20s and 40s. And these are the years when people are expected to achieve things, to do things, to create a family, get into their career. And sometimes this can be taken away from them, as it was taken from me. I was just starting to teach psychology at university, and I was battling with the condition. The university paid for my master's degree. They were so kind to me, but I had to drop all of that. And often it happens with people with similar conditions. So how can CBD maybe help support us during these difficult times?
Well, it's complex, and there's a variable different mechanisms that are at play. But primarily in anxiety and depression, we are related to an inflammatory condition of the brain. And for that reason, CBD is particularly well suited, because it is an anti-inflammatory, very specifically, and it's an antioxidant. And it targets the vascular cells, and it targets the neurons for developing more connections. Well, one of the problems with anxiety and depression and autism is there's a lack of connection that occurs, and reestablishing connections between neurons, and they're broken down. Well, cannabidiol facilitates that, as well as reducing inflammation in the brain. So that's very, very key and important. And there's on traumatic, post-traumatic stress disorder. It's explicitly that's actually a memory disorder. There are problems with inflammation, but as a memory disorder, it is CBD targets that very specifically. Now, in that disorder, there is a problem with remembering all these adverse events that they keep coming back, and we have revisiting images of recycling. Well, CBD actually breaks that, so that they're not revisiting them. And on the other hand, you have a problem with the extinguishing if you had a bad experience, we usually, forget it. And so you can forget that sort of problem. But PTSD, you can't forget it. And that's where CBD really comes in to allow them to forget it. And so that dissipates that problem, and they don't hold on to those particular memories. Now, autism, it has been shown very effective for autism. It's complex, and there's so many causes for autism. I don't think we can go into that, but invariably it's inflammation, it's new neurons. I think those are key and important, and it will correct for that, and then people will be able to control their anxiety, which is in autism, and they'll calm down, and so there'll be a better interaction with adults. Now, in dementia in particular, I'm thrilled that CBD has the potential to correct for dementia. In one of my patients, my first patient with dementia, I used it topically, and I had an exquisite result with it within 2 weeks. And whereas she was combative, she was threatening to her sister who was taking care of her, 2 weeks of topical applied CBD corrected that behavior, and she became a sweet and loving sister, and totally manageable by that amount of time. So there's a wide range of different effects that go on. It's neurotransmitters, it's inflammation, it's neuritogenesis and neurogenesis, but they all play a role in mental health and in our emotions as well.
Thank you so much for covering that. And the story with people who struggle with, as you said, the last lady that was threatening towards a caring sister, again, through the cafe and the people that were buying and were telling me how it helped them and changed, I'm actually familiar with a very similar story, and they said the change was great, like really making life easier and nicer for everyone around. And so it's great.
One of the things I point out to is caretakers should be taking it, just like with the mental health caretakers who were dealing with COVID. The mental health of the individuals who are caring for someone demented, they also need help, because there's a loss of sleep, there's anxiety, there's worries, and there's a great deal of stress that's on them. And CBD is primarily targeted at stress situations.
It's basically replenish anyone who's drained, and that's what you described, and how beneficial that could be. I agree with you, and I've seen it over the past 5-6 years that I've been working with it. Dr. Philip Blair, you are absolutely a phenomenon, and I really thank you for all you do for promoting CBD and sharing your knowledge on the cannabinoid system in the body, the receptors, and how taking CBD can help us.
But that's not the only cannabinoid. And now it turns out that liposomal, that beta caryophyllum is a terpene that has been around for ages. It's in 1,000 plants, and it has major effects on the endocannabinoid system very specifically, because it targets the cannabinoid type 2 receptors. And these are important because they control all of our immune cells. Now, whenever we have an inflammatory reaction, that goes through an immune cell, whether it's in the brain or it's in the liver or it's in our lymphatic system. And the CB2 receptors are actually present in all of those immune cells. And the caryophyllum has a specific target on those cells that can control it. So it's categorized as a terpene, but I think it should be recategorized as a phytocannabinoid.
Amazing, amazing. I want to hear more about that. That's very interesting, because for us people with immune conditions, that could be a key game changer. I know you mentioned it also has an impact on our cytokines. So that could be how it helps as well in reducing the cytokine storm. So maybe you can tell us a little bit more about it. And I know you also worked on a specific liposol terpene. You can say it. I'm already lost a bit for words, but you'll say, and I'll leave it in the link below so people can find this product. I'm gonna get one of you. I want to try it. It's all these things usually help me, so I'm definitely looking forward to trying it, and then I'll probably bring you back so we can talk more about it. But if you can tell us a little bit more about that, and then anything else you want before which I might have missed out, and I will see you in the future anyway. But it's back to you.
Well, first off, I want to mention about the fibromyalgia is that the cannabinoids, CBD, has been a key element in helping people with it, but it tends to help more on the symptoms. It doesn't resolve the syndrome in many cases. And although it's rated as a endocannabinoid deficiency disorder, clinical endocannabinoid deficiency is defined by Ethan Russo, MD, from a number of years ago. And he characterized it with migraines and irritable bowel syndrome as being a collective, that there's a common entity that is occurring there, and we don't know exactly what it is. But CBD has not been entirely effective for that. Yet it does have some benefits for neuropathy. And the neuropathic pain syndrome is characteristic of fibromyalgia. And so that is a particular target, and that is variable in terms of the response. Now, I bring that up because what I've seen with Caryophyllum that has targeted a neuropathy very, very specifically, and it has been having some extraordinary results that I've seen. And it does this by working on the CB2 receptor, but it also works on several other receptors that are in the body and in the spinal cord, in particular with a neuropathy sort of syndrome.
That's great to hear that how it's worked differently, and it could be one of them things that really impacts a person. And again, with these molecules, the special about them is that when you take them, you often feel the change or the improvement or the effect quite immediately. Where with some supplements and some stuff that you need to consume, like vitamin D3 and B12, you may not feel it straight away. You know it do you good. All the research is there. But what I like with these molecules we're talking about here today is that often the effect is immediately, and it's great. And I'm going to leave in the description below a link to this product as well, so people can have a look and study that.
With respect to the cytokines, now the cytokines are the inflammatory substances that are released by inflammatory cells. They recruit other inflammatory macrophages and other immune cells. And they also have direct action on some pain molecules that they will release those pain molecules, and they'll stimulate pain in different parts of the body. So the cytokines tend to be, but they're also protective. And so you need them initially in an illness or an infection. You need them initially, but then the body needs to control that infection, and then they need to die down. What happens in inflammatory disorders like rheumatoid arthritis is it may be ramped up, but it doesn't ramp down. So it's maintained inflammatory environment, and by the result of these cytokines that are being released. Now, COVID causes the release of cytokines very specifically, and a number of other illnesses, and including tumor necrosis factor, which is very, very common in arthritis and disabling. Now, we have developed pharmaceutical drugs for tumor necrosis factor, and they've been very effective, but not in all cases. Only about 35% respond, whereas CBD is very effective with it. Now, in my experience with CBD, that I replaced tumor necrosis factor antagonists in a medical program, in a therapy program, and we were able to relieve their symptoms that they were not getting relief with, and mitigate against their arthritis and their psoriasis as a result of that. Now, it turns out that BCP, beta caryophyllum, has the potential of doing the same thing by acting at the CB2 receptors that control the immune cells. Then you could have even more effect on these particular cells. Now, CBD and caryophyllum are work on the same receptor, but CBD works as a to enhance the endocannabinoid system and indirectly regulate the cannabinoid type 2 receptor. But beta caryophyllum is a direct action and a link agonist at the CB2 receptor. So I envision that that's going to be a very strong action, and I hope that studies prove that out. I've got a couple studies going right now on beta caryophyllum, but I have experience of over 6 years in using at least topical form of caryophyllum. Now, it is available as a topical oil, been in different concentrations, but the latest is that in my development has been a liposomal or water-soluble compound that has improved bioavailability. And so a small amount taken on order of merely a milliliter has had immediate and profound influences on inflammatory levels and cytokines, as well as the pain syndromes and neuropathy.
That sounds very promising and exciting, and I can't wait to try it. And I guess the combination of BCP and CBD together, it just gives it that full spectrum again and carries it in better. So that could be a game changer for many of us.
I think I've seen some of the best CBD has actually had significant content of caryophyllum. So as it is part of the entourage in hemp, but it doesn't have to come from hemp because caryophyllum is found in at least 1,000 plants. And it's one of the plants that we normally look at: basil, oregano, black pepper, hops, and cinnamon. These are all common substances that have been touted for their nutrition and their benefit. And it's merely a concentrated form of that. Now, this product that we've developed has an enhanced bioavailability, and so you don't have to eat a bushel in order to get the benefits of the substance.
No, it sounds amazing, and I like these things because sometimes you just forget to add cinnamon and basil, and you may take it some days and not that, but when it's in a supplement, it's just something you can give it a go for a few weeks, and it's easy to see whether it's working for you or not, and by the sound of it, it will do some
Well,
good.
speaking of seeing, one of the things I've seen very specifically is a profound effect on vision. In fact, I'm going to have a report today from a gentleman with a retinopathy, a macular degeneration and diabetic retina, that he has essentially cleared his syndrome in a matter of 3 weeks. So I think there's a huge potential for this in visually related disorders and for all measures, and it could enhance vision, whereas we don't have really any effective treatment for the retinopathies, and this is a potential that it could correct for many of the problems that people experience.
This is very exciting because one of the things with many autoimmune conditions, what I'm finding is that it often accompanied by brain fog, and one of the things that brain fog affects is your vision, your clarity. So again, real benefits in trying something like that. So I'm really looking forward to that.
One of the things that you allude to, though, is in brain fog is probably microglial inflammation and neuroinflammation, as well as a breakdown of the blood-brain barrier, which allows for substances that are normally in the blood to come and circulate within the brain, and those are often caustic to the brain. We know in autism and a number of traumatic brain injury, and Alzheimer's disease, there's a breakdown of that barrier, and for that reason, they are particularly sensitive to substances and inflammation in the brain. Now, cannabidiol and caryophyllum both work on bolstering the blood-brain barrier, so they prevent both of those things from manifesting. And in fact, autism has a considerable amount of leaky gut and blood-brain barrier leakage as well. So again, we've got huge potential in that area.
And talking about leaky gut and the blood-brain barrier, it makes me think of the digestive tract and IBS, which I suffer with severely in the past. It is much, much better over the years. Maybe you can touch about that. And as a small bonus, maybe a word or two about CBG as well, if we can throw it all at you. But you can choose and pick. I know it's getting long and people concentrate in Spanish, so it's not fair on us with brain fog, but whatever you're up for. So a little bit about IBS and how this BCP and CBD or CBG can help, and a last bonus word if you have the time on CBD, and then we'll wrap it up.
Well, it turns out the most prolific of neurotransmitters is actually in the gut. There's not in the brain. And so we have this huge system that communicates with the brain through the vagus nerve. And there's a great deal of interaction where you get sensing of in the gut, it goes up to the brain. And then there's a specific action that is taken through the vagus nerve from the brain. So we've been ignoring that for the longest period, but now we have the science to show that there is a direct connection. Not only that, there are circulating substances that cause inflammation in the brain, and the toxins that can come from the gut, from a leaky gut, can lead to inflammation of the brain and in that area of the body. So it's paramount important that we have a well-functioning endocannabinoid system, both in the brain and the gut, to deal with these particular problems. Now, in the gut, we know that cannabidiol has a very specific action on regulating the muscular activity, as well as the inflammatory syndromes that occur in the gut. Now, beta-hydroxybutyrate is a key molecule in the gut, and CBD actually promotes that. And it is key and important in the signaling. The beta-hydroxybutyrate is signaled through the endocannabinoid system to the brain through the vagus nerve. So that's a key factor. And so you get muscular, and you get neurologic, and you get immunologic effects from the cannabinoids on the endocannabinoid system from the gut, and they affect the brain. Now, you can mitigate against many of those problems using CBD, and it turns out caryophyllum also mitigates against those things. In fact, I've seen stories and testimonials from individuals taking caryophyllum, well, it has calmed their stomach immediately after taking it. I've treated some inflammatory bowel disease with CBD, but I've had mixed results thus far. So I'm hoping that caryophyllum will be the answer to many of these particular problems.
That's great. Yes, that's something I would definitely like to try. And as you mentioned, and I think from my psychology background, the same amount of neurons in the gut as in the brain. And if CBD and BCP has effect on them, then of course it will work both ways. So that's great. Any last thought you'd like to leave us with? Anything? I'll leave it to you. You've been fantastic as always. You've been also, I've written the little book of CBD, and Dr. Blair was there throughout. He didn't have to, I didn't know him so well at the time, but he really gave me a lot of his time, and he was very kind to me and those who helped me at Penguin Publishing House. He helped us to guide us, just to make sure the science and a little bit is more there. So thank you for that as well again.
Well, I wanted to mention the antibacterial properties of both CBD and Caryophyllum. Now, they have also antiviral properties as well. So I didn't mention that in the COVID, but that is an important part of the effect of it. Now, in addition, they have anti-parasite and other anti-organism effects. So it would be effective against spirochete and Lyme disease as well. So it has an amazing blend of anti-organism, anti-biologic symptoms, except that it enhances the biologic activity and it encourages cell growth and on the body, on the human body, but it paralyzes that of organisms that are attacking the body. So, you know, I appreciate this opportunity for me to recite my limited learning on these valuable substances and to relate the experiences that I've had. And that's one of the things that I do in my book is I talk in the final chapters, the final section of the chapter about the different clinical experiences that I've had. Now, the book is medicinal cannabis and CBD and mental health care, but it has ramifications for many types of illnesses as well. However, it is focused on the medical provider. So I don't want to disinform people about the purpose of the book, and but it's a valuable, I think it's a valuable book for mental health care providers as well.
And if you're a medical professional, a GP, family doctor, please educate yourself on CBD. I know it's something that wasn't taught in medical school maybe 20 years ago, 15 years ago, but it makes impact on so many of us in a positive way. And sometimes I hear people going to their GP or family doctor and they would say, we don't know enough about it, therefore we don't recommend it. And then the patient may lose out. So if you can't, do try to get Dr. Philip Blair book and other resources, just so we're all on board and it's easier and it gives us more confidence. And I think that's how it will come. And I will say last point, which is about aerobic and anaerobic, and maybe you can grow. It sounds really good how CBD and BCP and cannabinoids can and terpenes can have an impact so good on our body and oxygenate it, yet affect organisms in a different way. So how can, we may ask, how can it damage one organism but support us, which is also an organism? So maybe just to clarify, you can tell us about anaerobic and aerobic things and how it works.
Well, I can tell you that it is superlative working on mitochondria. And so that you have the energy determination, you have your energy source as in the body, in the cell, is the mitochondria. And it has antioxidant capabilities. In fact, it's better antioxidants than vitamin C and vitamin E. But by that action, it negates the reactive oxygen species, these inflammatory molecules that we naturally produce. And by eliminating those, then the body can work better and it can work more fluently, and it can actually reproduce mitochondria in greater numbers from what they are at the present time. So there's a great potential for the effects of CBD, at least that I know about now. I don't know the connections for beta-caryophyllene on the mitochondria, but it's probably going to be beneficial in some way because caryophyllene also has antioxidant capabilities as well. As for anaerobic metabolism, you know, our bodies are designed to be under stress a period of time, but we have to resolve that stress. And so that when we deal with stress, we produce reactive oxygen species. And then these molecules the CBD and caryophyllene can mitigate against those problems when we do have anaerobic. And then for ischemic type of events where we get a limited blood supply and limited oxygenation, then they're critical for causing disease and the death of cells, when these particular substances are protective against the death of those cells in that process. So it's so valuable that these can be on board to protect against ischemia, whether it's a stroke or a heart attack or other types of ischemia, and protect the body from the serious anaerobic activity that can occur.
Amazing. Thank you so much again, Dr. Philip Blair. I think we spoke a lot about the substance as an introductory. Anyone listening has more questions, I will leave details of Dr. Philip Blair and his website. You can look up more information. My website, you can get in touch with me as well to find out more. We're here to help you. So thank you so much again. And
my pleasure to be with you. And you asked me all the right questions.
Thank you. It's so easy with you because you allude to this anyway, so it works well. So I'm looking forward hopefully to do one more in the future. If people want more information, just leave a comment below. This podcast is both available on a podcast platforms and on YouTube, and also I will leave a link to my social media, so you can just comment what you'd like to learn from Dr. Philip Blair in future, and then we can approach him again, and hopefully we'll find again the time. He's a busy guy because he's still a practitioner and he does research and he writes and etc. Anyway, thank you so much. I wish you everyone all the best, and I connect with you again in a future episode.
Thank you very much. I appreciate that. And maybe we can talk about the CB2 receptor and the overall benefits of the CB2 receptor on the body.
I'd love that. Of course, that would be great. And so I'm going to try the BCP, and then we can talk about that. From my experience, I can't wait. That would be a great way to do it.